Hi, my name is Dr. Price, and I wanted to send you this video real quick to invite you to come in this week. We're offering a special consultation. If you feel like you might be suffering from a thyroid condition, we're offering a special consultation at a special discount. So I want to give you a little bit of information about what we'll be going over in this consultation and what you'll actually learn about yourself. A lot of patients that come and see me specifically for thyroid issues, they're suffering from symptoms like weight gain, can't lose weight no matter how hard they try, brain fog, hair loss, cold intolerance, all these different issues that are going on in their lives. And they don't understand why. A lot of times they've had all the labs done, they've gone to their medical doctor, they may even be on the right medications, but it's still not working for them and they're still having symptoms. So what we do in the office is we dig deeper. We try to find out what's going on, why you're still having the problem, and then go in there and address those issues so that you can actually get your life back and get those symptoms under control and reinvent your life and get that passion and that vigor back. So just a real quick overview of what happens with thyroid metabolism and what may be going on with you. In your body, the thyroid gland produces T4 and T3. Those are the hormones that the thyroid gland produces. If for some reason the thyroid gland, the T4 or T3 level, primarily T4, if for some reason that T4 level drops too low, it'll send a signal to the hypothalamus, which will then send the signal to the pituitary gland, which will release TSH to the thyroid to tell it to release more T4. So this is the basic thyroid, hypothalamic pituitary thyroid axis. This is how the thyroid gland knows how much hormone to release. TSH is what most doctors will check to see how your thyroid function is doing. So if your T4 levels are somewhat normal, your TSH levels are probably going to be somewhat normal. They're going to tell you there's nothing wrong with your thyroid gland. Now here's where it gets deeper. When the thyroid releases these hormones, about 7% of what's released is T3, which is the active thyroid hormone that the body can use. Approximately the other 93% is going to be T4, which is inactive thyroid hormone, has to go through a chemical process in order to become active so the body can use it. So what will happen is this T4 will get on thyroid binding globulin. It's a little globulin that takes the T4 out for conversion. That will be delivered to the liver, to the gut, and to other tissue. About 80% of the conversion of T4 into T3 happens between the liver and the gut. Okay, now this is just a very, very basic example, but you may have normal TSH levels, you may have normal T4 levels, but there could be a problem with the thyroid binding globulin, there could be a problem with the liver, there could be a problem with the gut, and if there's any problems anywhere in there, you're not going to be converting that T4 to T3, so you'll still be having symptoms, and the TSH level could be normal. So that's one reason, one example of why you could be on the right medication, your lab values may be normal, but you're still having all these symptoms. That's not even taking into account the adrenal glands, the blood sugar handling, all these other factors that are involved, anemias, all these other factors that are involved in this metabolic process. So that's what the goal is of this initial special offer that we're having this week. When you come in, your first visit, I will review all of your previous labs. I will take you through a complete neurometabolic evaluation so we can determine exactly what's going on with your body, both brain and physiologically. And then I'm also going to get some very detailed statistics about you and have you fill out some very detailed questionnaires so I can know what's going on with your history, so I can track what's been going on with you. After that visit, I'm going to sit down, I'm going to explore all this. I'm going to figure out what's going on with you, why you're having the symptoms you're having, and I'm going to explain that to you. So on a second visit, when you come back in, we're going to review your findings. I'm going to review everything that I found and explain to you what's going on with your body. You'll be shocked at what you will find out about yourself, I guarantee it. And on that second visit, I'll make recommendations and we'll see what we're going to do as far as treatment is concerned. So I highly, highly recommend you that if you're still suffering, that you go ahead and make the appointment. Go ahead and come on in, let us check you out and see what we can help you figure out. And also stay tuned. I've got that testimonial for the patient that one of our patients has been in our office before. So enjoy that testimonial and I hope to see you soon.
So prior to my coming to see Dr. Price, I was unable to lose any weight. I actually gained about 30 pounds. I couldn't even get off a pound. I had trained for a half marathon and still could not lose any weight. I came to see him in July, and since July, for about 3 months now, I've lost about 26 pounds and about 4% of body fat now. I'm sleeping through the night, which is huge. I used to never do that. My energy level has increased significantly, and I just feel better overall. Have a lot more level of alertness in the afternoon than I used to, and I would definitely recommend that people come see him that need help. I also don't feel as bloated and sluggish as I used to. He's definitely been a godsend for my care.